Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms, and it is February, and we are bringing you another hot health topic, courtesy of UTMB Health, our preferred provider for the Southeast Texas, Clear Lake, Bay Area, Galveston, League City. All of you down there, UTMB Health is the place to go. We love bringing in experts every single month to speak to topics that you want to know about. And this month, we are going to be talking about all things high risk pregnancy. So last year, if you recall, we've touched on OBGYN and pregnancy and pregnancy visits and what all of that looks like, but we didn't get into the high risk area. And that is something we really want to dig into today. So today I'm thrilled to have Dr. Vu join us. She is with UTMB and she is in the Clear Lake area. And Dr. Vu, it's great to see you.
Hi, thank you for having me.
Absolutely. Can you give us a little bit of background on you?
Okay, I trained at UTMB. I finished my residency in 2014, and then I joined a private practice in Houston for a couple of years, and then worked also as an OB hospice, doing inpatient and OB emergency care. And I've just recently returned to UTMB, came back to where I started. So I started working here a couple of months ago, and I'm really enjoying it so far.
Good. Well, welcome back. I am sure they are grateful to have you with all of your experience. And so let's just dive right in. What is a high risk pregnancy? What does that even mean?
Um, so a high risk pregnancy is any pregnancy that is, I think it sometimes is even easier to define what is a low risk pregnancy. So
Okay.
basically, a low risk pregnancy is a pregnancy that mom is completely healthy, has no medical problems, and we anticipate that she's going to have, a normal vaginal delivery. Anything that's outside of that is going to be defined as a high risk pregnancy. So who is at risk of having a high risk to be defined as a high risk pregnancy? There are a couple of categories. So it would, one category would be moms who come in or become pregnant with medical issues or some condition that's pre-existing. So that could be advanced maternal age. I know, now in life, we all delay childbearing. So it's becoming more common. But any pregnancy over 35 years of age is considered a high risk pregnancy.
Okay.
On the opposite end, any teenage pregnancy when mom is very young is also considered a high risk pregnancy.
Okay.
High risk pregnancy also include moms with pre-existing medical condition, such as any heart issues, high blood pressure, pre-existing diabetes, thyroid disease, seizure disorders, any of those things. And then, something that you need to be maintained on with medication and being cared for under a provider before you got pregnant. So those would put you at high risk. Also, sometimes personal choices or lifestyle can increase the risk while you're pregnant, such as smoking, alcohol use, any drug use, and weight is also an issue because it puts you at risk for other chronic medical issues. So obesity is also considered high risk.
Okay.
And then not just, entering the pregnancy, you might have a complete, healthy, normal pregnancy, but eventually as time goes on, pregnancy complications can develop. finding out that you have multiple gestation, twin pregnancies are very common. There you go. Twins, triplets, those are becoming more common these days. Any bleeding issues that happens earlier on, that carries on throughout your pregnancy, you won't find out until you are already pregnant. Any issues with the placenta, any issues with, diabetes that can develop during pregnancy, or blood pressure issues that can develop during pregnancy. So that will make you at that time, whenever that is diagnosed, to be a high-risk pregnancy.
Okay. So there are a lot of things that high-risk pregnancy covers.
Yes.
It kind of seems like a wonder we have any low-risk pregnancies, to be honest. But we do, so that's good. If we don't, we have the high-risk specialists, like yourself. So how are these high-risk pregnancies diagnosed? How do you determine that someone is high risk, and you automatically scoot them maybe from an OB, like the regular OB, to more high-risk OB?
So I'm actually a generalist. So,
Okay.
I know that list sounds very long, but most pregnancies are actually low risk pregnancies. So this
Okay.
is the focus of our discussion. So we mentioned all of those things, but most of our general population, they're healthy young women, with normal low risk pregnancy, with normal expected, low risk deliveries. So I don't want this conversation to scare anyone,
Yeah.
because most pregnancies in our practice and around the country are actually low risk. So
Good word. We
yeah,
need to.
so I'm a generalist, and we do manage low risk pregnancy, as well as some of the high risk pregnancies, and the extremely high risk pregnancies. We at UTMB have a great team of maternal fetal medicine specialists. They are, the really high risk patients. We'll either consult them for co-management of our patients, or if needed, then they will assume care of the really high-risk pregnancy patients.
So it sounds like for a lot of it, you can take care of the high risk and just, in your office, but things may look a little bit different. So if we've diagnosed a high risk pregnancy, how does the care different from there? Is it more ultrasounds, more checkups, what does it look like?
Yeah. It depends on, what makes you high risk will determine your course of care. Somebody who, have well controlled, let's say a thyroid disorder, you might have your thyroid blood test, your thyroid function test, once every trimester. And that could be done in conjunction with your normal routine visits. So if you have a chronic medical condition that we've mentioned before and is well controlled, then it wouldn't necessarily, change the course of your prenatal care as far as the number of visits or ultrasounds. But certain conditions, such as, let's say, advanced maternal age or multiple gestation, then you will then have more detailed ultrasound at your 5-month anatomy scan, and then have serial ultrasound after that to just make sure the baby's growing well. So, and then medical conditions such as diabetes or hypertension or high blood pressure will see each other initially, if it's well controlled, in the same, prenatal visit number of visits as a normal pregnancy. But towards the end of pregnancy, where risk of complications can be higher, then we'll visit with each other more often to perform ultrasound, to monitor baby a little bit more, to review your blood glucose if you're diabetic, or your blood pressure log if you have high blood pressure, and we'll meet with each other more often to do those. So then it could be, instead of every 2 weeks for a normal pregnancy, we'll see you weekly.
Okay.
Yeah.
And I kind of remember from my high risk, I mean, obviously I didn't love being classified high risk, but it was kind of nice to have all the different check-ins
Yeah.
and know that you were being so well taken care of. And I know that's what the team at UTMB does. Now, can every OBGYN handle a high risk pregnancy, or are there just certain ones?
I think most OBGYN can handle a high risk pregnancy. It just depends on where you fall on the spectrum of being defined as high risk. But you will usually have a generalist, an OBGYN, to take care of you throughout your pregnancy. And then at any point, any issue arise, then we will consult with the maternal fetal medicine specialist and make a decision at that time whether we can co-manage, and the patient will continue to see the generalist with a call to the specialist or an extra appointment with a specialist as needed, or it needs to be a complete transfer of care.
And that's what every time we have these videos, I always talk about this, but UTMB does an amazing job of having that super comprehensive care so that if it's somehow for whatever reason out of your realm, that it needs to go to a maternal fetal specialist. Is that what?
Yes, maternal fetal medicine specialist, yes.
And you guys can coordinate that care and make sure that there's a transfer care. And it's very seamless. And I think a lot of moms take comfort in that. And it's a huge benefit to UTMB.
Yeah, and it is a seamless transition because we're under the same system. So then you don't have to worry about, your insurance and the financial side of it when you're already, worried enough about your baby. So then it makes it a little bit easier, just getting appointments, knowing that your doctors are practicing. We have here specifically at Clear Lake and at other locations too, we have a maternal fetal medicine specialist that is here once or twice a week. So, if they see one of our patients, if anything, they'll walk over to our clinic just to discuss a plan of care, so that we work closely with each other, seeing each other face to face, so that there is a good transition if it needs to be, or just a good connection so that nothing falls through the crack.
And that's so incredibly important. We had a video last month and it was talking about how well your team functions together from like an OB perspective, in that like if you're not there, well, somebody else knows what the plan of care is for this patient, and the same applies for high risk. So by the way, plugs for last month's video. If you didn't watch that one, go back and check that one out. I'll post it in the links as well. Because I think that would also be a great video to watch if you're pregnant or considering getting pregnant. And that would be an awesome one to go to. So what would you say, Dr. Vu, to the mom who has maybe gotten the news that they're technically classified a high-risk pregnancy? What kind of encouragement can you speak to them about what that really means?
Okay. When you have a diagnosis of a high-risk pregnancy, again, high-risk pregnancy is such a wide range of, it could be any type of medical condition, but most of the time, a high-risk pregnancy will have a good outcome. When you're being told that you have you're now high risk, it just means that you need, closer follow-up. Maybe monitoring yourself at home. We will monitor you more frequently in the clinic, maybe some more consulting visits. All of these things are built so that we can detect changes early to prevent a bad outcome. What you need to know is most people who are classified as high risk will end up with a good outcome and a normal vaginal delivery at term. And that's, how most people are delivered. So it's just increased surveillance, and for both your peace of mind and our peace of mind as the people taking care of you. So just so that we can detect things early, manage things early, treat you early so that you could have the best outcome that you could possibly have, and baby will have the best outcome also.
I love that. I think that's perfectly said. Because we have one goal, right? And that's to get baby here. And well, I say two goals. One goal, get baby here, and two, keep you safe
Yes.
during your pregnancy. And so a little extra love and care is never a bad thing sometimes. Providing that extra peace of mind. What else would you like to share? Is there anything we missed about high risk pregnancies from your perspective?
I think one thing that I want to mention is that, most pregnancies in the world are surprises. So, you'll come to see us for the first time already pregnant. And of course, that's perfectly fine. Again, that's how the world works and that's how it's been for years. So nothing is new, nothing has changed. And then we'll manage any issues that come up as soon as we find them. So that starts with your first prenatal visits. We'll go through your history. We'll do lab testing. Then we recommend, certain routes of screening for different things that would rule out you as a high risk patient. But if possible, if we're talking about, increasing the chances of having the best possible outcome, I would encourage that, everyone, when you're thinking about getting pregnant, to come in, see your primary care provider, your family practitioner, or your OBGYN, or your nurse midwife and your nurse practitioner, whoever that may be for you, to have preconceptual counseling. Because, at these visits, we sit down, we go through your history, we go through what possible risks you could have and what risk modification that we could help you with, so that, when you do actually become pregnant, you're at the best possible you that you could possibly be, both mentally, physically, so that, that you're ready for the pregnancy.
That is excellent advice. And I don't think we hear that enough of, like, hey, like, I think I'm ready for a baby, instead of just like, hey, we're like, put on some music, like ready for a baby. But like, we also need to make those pre-visits. I remember my best friend did that like 12 years ago. And I was like, I didn't even know you should do that. And so I think that's great advice. And then that way, if there's medications that you're on, or certain things that you can start, making adjustments to all of that. So your best version of you, I think, is how you put it, when you do get pregnant. Great advice there, Dr. Vu. I really appreciate it. And as always, we will drop the links below. I will drop the video from last month, because I do think that's a really important one to go back to. We will also drop a link on how to find a provider at UTMB Health, and like Dr. Vu, and these comprehensive teams that work together. They're there for all of our Houston Southeast parents and moms as you enter this exciting journey, maybe for the first time or the fourth time, but it doesn't get any less exciting, and sometimes a little scary. And so we want to keep you safe during your pregnancy, and if it happens to be high risk or low risk, UTMB has you covered for sure. Dr. Vu, it was a pleasure. Thank you so much for joining us.
It was a pleasure to be speaking with you. Thank you so much for having me.
Yeah, welcome back to UTMB Health. And until next time, Houston moms, we will see you in March with another great health video that you for sure will want to check out. We'll see you soon. Bye-bye.
Bye-bye.